Welcome, everybody. My name is Stephen, and I'm going to be your moderator this evening. I'm very excited to welcome Dr. Matthew Annese, a general practitioner, esteemed lecturer, for a look at how he incorporates his 3D printer into his day-to-day restorative workflows. So before I hand over to Dr. Annese, I'm just going to take care of a couple of points of housekeeping. Firstly, if you have a question at any point during this evening's presentation, you can go ahead and enter that into the Q&A box, and we're going to do our best to get through as many of your questions live at the end. And the second point is CE is not available for this webinar, and that applies to whether you're watching it live or on demand. So with that, welcome, Dr. Annese. Thank you, and I'm going to pass it over to you now.
Hey, Stephen, thank you very much for the introduction. Welcome, everyone. Thank you for taking the time out tonight. Basically, we'll get going here. Just want to respect your time. I know everyone's busy and have 3 kids put to bed pretty soon. So we're going to discuss and dive into 3D printing into your dental office and kind of go through a few cases that I have documented and gone through and shown the value of adding 3D printing into your office. So let's dive into it. So over the next hour, we are going to cover, why. I think I add a lot of asterisks there. I think that's the most important question. Why do I need this? What can I do with this? What procedures? How will this help me? How will this help my patients? I think we'll answer that pretty thoroughly. We'll touch briefly on what to look for into a 3D printer. There's so many new printers coming out, new companies adding printers. What do I look for? How do I choose? How do I pick the right one? Okay, I buy a 3D printer. What else do I need? Do I need to buy all this other equipment? I think most of the other equipment you should have if you're part of this lecture, or you should be getting pretty shortly. And then shortly, we're just going to go through cases going on in my office. I think most of the ones we pulled through are ones that have been going on the last couple of weeks, last month or so. So they're pretty fresh in my mind. Like I said, I'm using 3 or 4 3D printers day in, day out. They're constantly going. It's a technology that I fully adopted, and I truly believe that you should as well. And lastly, I want to make sure that you're getting value here at this webinar. I want to answer the questions that we do have, and then also I'm going to leave my contact information at the end. I know a lot of people can't stay on, or we don't get to your questions, so I want to make sure that you have the ability to reach out to me to answer any questions that you do have. It's not going to go deep dive into specific topics. There's webinars that will go into hyper specifics, procedure step by step of designing, CAD designing. We're just going to say really high surface level, and then we're going to kind of show what value a 3D printer provides and how I use it and what it does for me in my practice. So a little bit about me. I have 2 general practices outside of Boston, Massachusetts. My first 3D printer was purchased in 2018. So some of the cases I'm going to show you, you're like, wow, you must have dove right in. You must have implemented this right away. You've been doing it for 5.5+ years. The first one I purchased, so it was part of like a scanner bundle, and it collected dust for 2.5 years. No one knew how to use it. It was still kind of early into the 3D printing and dentistry phase. You heard about it, but you're basically printing models. That was about it. There was no AI. There was no resins. There's like low FDA approval. But I still bought it, and then it sat there for 3 years. But I knew I had it. Then, all of a sudden, there's big boom in 3D printing and dentistry, and I already had the equipment. So I think learning about what it can do and then purchasing would have been much smarter, but I kind of dove in. That's kind of how I practice. But now I think it's a no-brainer. There's so many things you can do with your 3D printer, as we'll discuss. And I personally focus on full arch implant dentistry. That is where my 3D printer gets the most use, and my laptop gets the most time cleaning the printer, printing, staining, glazing the resins. But I also do a lot of complex restorative because we cater towards and advertise towards full arch implant dentistry. We get a lot of people that we talk out of implants, and we end up doing complex restorative. So the 3D printer really helps in those cases as well. And like I said, 3D printer going every day, both offices. My main office, we have 3 or 4 going all at once. This is the setup. So these are the printers I have. As you'll see, I'm agnostic to printers. I'll mention a few companies. I'll mention some startups, but I don't have a stable of one company. I think they all provide different services. I use them for different things. They have different resins that have benefits. The speed, the accuracy, the workflow. Do I need a lab tech? Can my assistants do it? Each one of these has those pros and cons associated with them. So we just made sure we checked every box. So we have the full sprint ray, the Pro 55 for the hybrids with the Onyx. We use, for all the Onyx surgeries there, but my assistants are easily able to just do whatever dent guards at that office pretty easily. We have the E1. This was when I got introduced to full arch implant dentistry. We have the Asiga, the Denifab. The Proform 2 is that first one that collected dust for about 3 years. So there, it's still operational. We have a Proform 2. And one of the most important parts is we have kind of a full exocad suite and dedicated lab tech. Even if you're getting into this, you may want to get a dedicated assistant, someone that can clean the resins, maintain, upkeep, because it does become a full-time job as you implement this pretty quickly. So again, going back to that question of why. Why do I get a printer? What does it do for me? I'm fine without it. I don't need this. I think you get a vast amount of procedures done for a relatively inexpensive piece of equipment. And compare the cost of like a CEREC, Sirona, milling, you're looking at $120, $130, $140 for brand new. And that basically does crowns. You could say surgical guides, you could say temporary crowns, you could say bridges, but that's, pretty price to pay plus, $40 a block to get it. I still have one. We use it in my practices. My associates love it. But if you're worried about cost of entry into buying a piece of equipment, I think a 3D printer is going to give you a significantly better ROI kind of right off the bat. There's a constant evolution in the additive manufacturing market. There's companies down the street from here in Massachusetts that are doing 3D printed metals. It's constantly, you're not taking a piece and reducing it down to what you need. You're just using a material and then building up and not having as much waste. So it's really where the focus is adding to in technology and adaptation. Your speed, your resin profiles, the clinical techniques that you can implement, and then especially AI. This is getting really big. I mean, you may hear about all the chat boxes on the news lately, but they're constantly growing, and soon I'm sure the designs from AI will surpass most of the lab techs that you use. There's better clinical outcomes for patients. You get an immediate ROI once you start implementing the 3D printing technology. You can lower your lab bills, and then there's a lot less chair time. And I'll kind of explain that shortly with some of the procedures and techniques. And I truly believe it's one of the biggest tools that you can add to the dentistry that you want to do. It's made my life significantly happier, easier. It's made my assistant's life easier. I mean, it's probably made my lab techs significantly harder. They're constantly printing, fixing broken things, staining, glazing. But it's all with a 3D print. It's all with an STL file. It's all just press play when things go wrong. So I couldn't imagine practicing dentistry and doing the dentistry that I do without it. So so if I haven't convinced you, or if you haven't dove into 3D printing, you're going to see a couple of the big names here. Again, you can buy a $300 one on Amazon. You can do a bunch of different things, but your Sprint Ray, Formlabs, Asiga, Desktop Health, Accu-Artisol, Dentsply, has a new printer. These are some of the bigger ones. Not saying that there's other ones out there, but these are some of the names that you may hear from time to time. Social media posts, lectures, CE courses, conferences, etc. And some of the ones that I have more familiarity with. But so basically, here's some of the things that you want to look for when you go to try and buy a 3D printer if you haven't yet. You want to look into the SLA versus DLP. The next slide is going to touch on that a little bit briefly. We're not going to go too deep into that. What's your build platform size? That's going to be important based on what type of procedures that you do. When I buy my 3D printer, I'm looking to print like 2 hybrids at a time. Sometimes 4 if I'm printing 2 dual arch at a time. I don't need the same build platform that I would need if I'm an ortho or an ortho focus that just wants to print models and do suck downs. Like, those are 2 very different things. I don't need as much accuracy or layer thickness and print time as I would. So procedures that you do and what you want to use it for is probably one of the more important things to focus on, because that's going to dictate build platform, and that's going to dictate the print time, layer thickness, and accuracy that you need. Because the thicker the layer, the less accurate, but the faster the print time. And a really important thing is it an open or closed system? Again, kind of touch base on Sirona again, like we've all known that's a pretty closed system. But can you sit there and just add a resin profile, shoot the company an email, say, hey, I have this resin, I really like it. Can we add it to your library to print, to post-process, and to cure? And some say yes, some say no, it has to be our own unique resin. Is the resin tank something that fits universally? Do you pour it in? Does it have to snap in? Those are some of the questions to ask before you buy. Is a company a constant innovation? Are they adding procedures? Are they adding materials? Or is it just a printer that you buy, like I said, off Amazon? How easy to change the resin, the maintenance, the post-processing? Like, I've had assistants ruin like $800 resin trays by just spraying Windex and scraping clean because they look cloudy. It's is a tiny little tear happen if you don't baby it? Does it is it like a Ferrari that you have to do all this work and it'll work perfectly, it'll run like a Ferrari, but you have to make sure you upkeep it like one. The post-processing, is it streamlined? Is it kind of all enclosed? I know that's one big thing Straumann is focusing on. Is it fast? Does it cure time? You can print in 10 minutes, but does it take an hour to cure? All these things are really important to kind of determine how it works in your day-to-day workflow and your practice. So here's touching on the SLA and DLPs, the two type of printers. LCD, I haven't really seen too many in the dental field, but you're mostly dealing with these two. So basically most of the 3D printers now that you'll see are going to be more the DLPs. SLA, the big one, is Formlabs. It's a great 3D printer. It's not as fast for me what I use clinically nowadays. But if you need a super accurate print, we still use it, from time to time. If we have time, we're not doing same day chairside sort of temporaries or same day chairside hybrids. We can use the resin profiles with an SLA to get really super accurate information. And like I said, with the evolution, when you buy the printer, it doesn't just print itself. You can't just scan, print. There's the most important component, the CAD component that we're going to touch on. The design. How does it take your STL or PLY or OBJ files, and how does it get to the printer? Is there something intuitive that's built into the ecosystem? Is it something that now you need 3 different parties and it just accepts any STL, PLY? So there's something that to kind of consider is there a home base, or are they trying to build a home base that can communicate directly with your printer? So that way you're not going to that extra step, that you can use the power of AI, that you can use the power of outside design to be able to streamline. So, I mean, personally, I think for me, I've had friends that I've recommended, I do believe the Sprint Ray is an amazing intro into 3D printing with some of the adaptations, and we'll touch base on some of the innovations that they have coming too. But this is something that I haven't seen many other printers kind of implement. So you got your printer. It's you don't just plug it in and expect it to work. What do you? I don't want to say the word need. I don't tell the patients they need dental treatment, but it's a strong recommendation or something that we all kind of should have at this point to be able to work alongside your 3D printer. Your intraoral scanner. I have 3 Trioses, 2 Medits. I have the Prime Scan. I have the iTero. So I'm fully all immersed into 3 intraoral scanning. I maybe take 1 or 2 traditional impressions per year. Sometimes if I want to do like a really high-end press, ceramic lab case, then I'll do a traditional PVES just so that my lab tech can do more of like a press ceramic. But mostly I'm doing day in, day out intraoral scanning. I believe in it. It's the prices come down so little. What you can do with these scanners is amazing. So I would say get into digital scanning before you get into 3D printing, but definitely do both. Sometimes, like I said, I bought my bundle 3D printer with the Trios bundle. Cone beam, again, I have 3 of them. in 2 offices. I have 2 in 1 office just in case one goes down. I use it day in, day out. It's, something diagnosing, doing implant dentistry, I can't live without. And you want to get into implant planning or doing surgical guides in your office, you're going to need a cone beam. You can't do it with a pan. Quality 2D camera. There was supposed to be a 2D camera, but then this 3D facial scanner. So we have like the Vectra H2, which really helps with dialing the diagnostic. It eliminates the mesh between a 2D photo and a 3D design. You can use your iPad. It will show a little trick too of using your iPhone or digital phones with some white boxes. Digital CAD system. This is where you're going to be doing your computer-aided design. There's a bunch of systems out there. We'll touch on a few that works really well between some of these digital impression systems and the 3D printers. And then you print it. We're going to briefly touch on this, a standing glaze kit. There's a bunch of them in there. When you print them, they're all kind of monochromatic, but you can make these look really nice. Your assistants can make these really nice and watch like a 5-minute YouTube video on standing and glazing with some of the kits. So your CAD is going to be helping communicate your digital impression to be able to print what you want to print. ExoCAD is the 800-pound gorilla. It's one of the most utilized by lab techs. Almost all the labs use ExoCAD. We have a full dedicated ExoCAD suite. I'm a fan. It's expensive for what it is, but it is something that, again, I can't practice without. Most labs can't practice without it as well. Mesh Mixer, if you wanted to get really deep into doing it yourself, DIY, it's a free software. It's great. It works well. There's some great lectures that go deep into it. I don't have the time nor the bandwidth to get that deep into it, but it is one of the options that's free to download. Blue Sky plan is a great plan too. A lot of places utilize this. The great thing is they just charge on exports. It's otherwise a pretty free plan. A lot of education, a lot of lectures, a lot of people that are pretty big into the whole digital dentistry realm are part of Blue Sky. Smilify and DSD are kind of a little branch off of the same. They branch off of DSD, I believe. This is going to be really good for kind of the shell temporaries, selling your patients for aesthetic rehab, showing them what they need as far as planning on an iPad with just basically a photo on an iPad in a digital scan. It's going to be pretty seamless. I'm getting a little bit deeper into these, which is great. It's pretty easy to learn, a lot of classes, and it really helps with case acceptance, with patients. Trios has their design studio, which is great. And then, you have CEREC, and since they've added the 3D printer, they're in lab. Now, if you have a CEREC, you can use any scanner to print to the printer if you buy the printer, so you don't need to get a CEREC to be able to mill if you have an outside mill. I know that's one of their selling points of their printer. Or you could just outsource. You can send the scan, you can send the photos. In a lab, you can get you an STL and PLI, and you just print. You don't have to worry about doing this, learning the software. They're all pretty proficient with this. We use outsourced labs for a lot of our same-day 3D printed temporary hybrids. It's something that is an option. A lot of labs are kind of going towards this because they don't have to be in charge of the manufacturing aspect, especially with the 3D printing. So look for labs that do some outsourcing where they accept your files and they just send you the file back that you can print, you can be in charge of, you can control, and you can have in your back pocket when things go wrong. Like I said, briefly touch on the standing glaze. Here's the optic glaze. This is kind of our bread and butter wheelhouse. We we add this to a 3D printed resin. It makes it look amazing. We'll show you some photos shortly. You have Mio. Mio is more zirconia, but you can still use it for some resin. I would say wafer. It does look amazing on zirconia, but it is an option for 3D printed resins. And Axiom for the pink composite, and Larry's Magical Denture Elixirs. There was a time there was a big hybrid boom kind of across the country, like 2021, 2022, which is wild. But optic glaze you couldn't buy. It was like sold out everywhere. So this Magic Elixir stain was great from Taub Dental Lab, New Jersey. They're responsive. They look good. It's pretty easy to use too. So it kind of saved our butt a little bit during that time where we couldn't buy optic glaze. So the most important thing now is we talked about what can you print with a 3D printer. We're going to stay super high level, super basic on a lot of these, and we're going to do a deeper dive into some of these. So we can do models, occlusal guards, surgical guides, denture bases, and teeth with flexible base resins too. There's a cool case I'm going to show at the end that kind of we did today. I took some photos today and just added to the presentation. Temporaries, we're going to spend a little bit of time on this. Metal and temps, implant temps, shell temporaries for kind of case acceptance, mock-ups. Temporary hybrids, again, this is my wheelhouse. I've done a lecture with Schein kind of on that whole workflow and what that does. I'll just show them the cases and touch on those briefly. You can print, anatomy for planning. Typically, this is going to be big in zygomatic implants. Permanent crowns, question marks, we'll touch at this. Metal, it's supposed to be coming. That's probably coming soon. Accessory components too. We print like a VD. You can get an STL and print anything. There's VDO gauges. There's adapters that we use. There's stuff for our sandblaster. There's a lot of things that you can print that helps your day-to-day, everyday office that you would, otherwise have to go buy or try to find. So you can print whatever you want with it. So it doesn't just have to be related to patient care, but we're going to mostly focus on that right now. So models, again, your two big things for models. You're not going to print, patient records. You can keep them in the digital realm. But the biggest thing is if you have a big aesthetic case, if you have someone that, it's a big aesthetic restorative, you can make sure that your digital model fits onto a model. So that's usually the only times that we use models. I don't really even use these. We do everything kind of modelless in our office from start to finish, but from time to time, it's nice to see it seated on a model, path of draw, path of insertion, undercuts, make sure it fits. So from time to time, we will do that if it's a little bit more difficult case. The other time you're going to do models is in-house aligners. So you're a big aligner practice, you want to bring this in-house. You can show a STL in photos and they can give you a proposal of what the treatment would be, and then you just print out the progression of the models. I've heard since my first course in January 2018 into 3D printing that they're going to be able to print these, the liners directly. And I heard into 2020 is coming soon. I heard in 2021 is coming soon. I don't know when it's coming. So it's still going to be your traditional print the model, print the progression, suck down each one and deliver those trays. It's still much more economical. It's just you have to find a person that's dedicated to doing printing, post-processing, suck down, and trimming and scalping of the gingiva for all of these. So that's where I kind of see the biggest headaches. My assistants would hate me if that became one of their jobs. So in my lab tech is much busier doing other things. So we don't really do the in-house aligners. We just pay the lab fee for Sure Smile or Invisalign. Surgical guides. If you're doing implant placement, I'm a big proponent and advocate for surgical guides, especially in the beginning phases or difficult cases. There's minimal reasons why you shouldn't. Ideally, you need a planning software for this. If you have it, you should have Blue Sky Plan. Like I said, it's free. You just pay on the exports. We have the full XCAD suite, so we have Exoplan as well. Pretty intuitive, pretty seamless, pretty straightforward. Implant planning, 3Shape, we have Implant Studio as well, because for trioses. All of these, you basically take a digital scan, you plan your dental implant, and then you can make a surgical guide. It's insane how fast it takes. It takes a matter of minutes. I'm using it mostly to do for pilot hole only. For difficult cases. I'm more the implant focus. We've done, I've done thousands of implants. So it's basically get me started, make sure my angulation, orientation, spacing is on, and then I can kind of take it from there. But you can print these for $2 to $3, or you can send this out to, versus I know before, I remember paying like $250, $270 for surgical guides back into the office. Or you can use an outside service. Like I said, there's lab processes that will sit there. You send them the STL, you send them the DICOM. They can do it and send you back the PLI and STL to get it done. So, and then just obviously remember, you need to buy the guide tubes for the fully guided. You need to get that from your, from your implant company that make sure it fits. Know if it's keyed, know if it's keyless, but we're not going to spend too much time there. There's plenty of tutorials, there's plenty of implant planning, surgical guide softwares out there, but it's one of the things that we kind of use day in, day out. But we take an STL, we take a DICOM, and I kind of go for like exocad 2.0 or 2.5 pilot only. So that's where we use it day in, day out. Dentures, we're starting to get more into this, not because I'm doing dentures. I personally, I don't do any removable in my office. There's no overdentures. We got rid of overdentures. We got rid of dentures completely. But basically, there's a lot of times where I'm doing people that have been knee dentureless that have come in with like no teeth, and I'm like, okay, well, for me to do this overdenture, or for me to do this hybrid, or I'm not overdenture, but to do this hybrid, or to get you something, I need a reference plane, I need to set up 8 and 9, I need the VDO, I need this. So we'll do a scan and we'll just make something up real quick. We'll print it kind of like this, a single base with this, and that gives me a reference, and then I can adapt and change from there. So it's pretty cool. If you're doing dentures, I still don't think they look as great. I've seen some that get really into it that look as great, but as like a pressed acrylic. But you can do it single unit. You can make it stain and glaze the teeth. You can stain the base, or you can print like a base, and then you can print teeth, and then you can loop these two together. That's what mostly we do. And the best thing about it, it turns your dentures into about 2 to 3 visit dentures maximum. You can sit there. It depends if you want to do rubber base and green stick compound and get the best impression, or I can sit there, get it pretty close with like a nice Liginot. I can do like a light body wash afterwards, set up 8 and 9, and then I can deliver second visit, maybe third, if I have to make some tweaks. I personally, the only time I use it is, like I said, if I have no VDO or reference, if I need to save or to get a case, and I'm going to talk about that at the end. This little flexible partial right here, kind of saved us and got us, a $30,000 case last week. And it's great for interims. I'll use this flex base if I'm doing a big implant case and the patient doesn't want to do restorative. Like we have to do 4 implants from 6 by 8 by 9 by 11, and we need something interim, and I don't want to rub against the tissue. Then I'll do a flex base partial that we can print for $1 or $2. So it's great. The patients are happy. We can get something. I can print a bunch of these. This patient. Yeah, I'll talk about this patient at the end. It's pretty cool what it did for us. But there's a lot of things you can do with dentures. It can take your denture process from 5, 6 visits, 7 visits, records. This video's off, or my bite room's there. You can tweak it all. Just as long as the 8 and 9 are set up and the video is established, you can kind of tweak it pretty quickly digitally. Temporary hybrids. Like I said, this is my wheelhouse. This is where I live. These are my cases. These are, just before and after, same day with temporary hybrids. We did a lecture on this. We talked about this. Went through this workflow pretty thoroughly. But this is where I couldn't live without my 3D printer. This is where I use my 3D printer. Like I said, we do 3 or 4 of these cases a week, so 3 or 4 arches a week. So I couldn't imagine living without this. We dial in the aesthetics, we dial in the occlusion, we dial in if something breaks. They're fully loaded, they're fully functional. I've done probably 300 arches, 400 arches by now, and all of them are pretty loaded right away, same day. So I couldn't imagine practicing without 3D printer. Like I said, we jumped into implant dentistry doing single units, 7, 8 years ago, and included this by adapting 3D technology plus, the changes in implant protocols. So just, again, some of the cases, these are just from all with over. Like this bottom right one was 2 days ago, but these are all just 3D printed temporary hybrids, before and afters, all same day, all of them in a matter of a few hours. Printed anatomy. This is more like getting into zygomatic processes. There's really no need to do printed, but you could take your DICOM file from your CBCT, you can convert that to an SEO, and then you can print this out. Again, I know almost all my friends that do zygos. I haven't seen the need there yet, but they'll sit there and they'll do a prep surgery onto your zygomatic process. So it's pretty cool. You can show patients. It's great to print. Like you can show them, a clear jaw with implants. You can show them an all-on-4. You can show them a single unit implant with like a clear resin. So 3D print anatomy is not just for yourself in practice, but it's also to show patient education. When you're sitting in a consultation room, patients try to imagine what it looks like, and you can kind of have them hold it and show it right there in front of them. So going into occlusal guards, I know we're supposed to do case studies and stuff like that. There's no need to do it. Everyone's done a bite guard. Everyone's done a bite splint. I know there's different types, different occlusal schemes, but this is by far one of the easiest and fastest ROIs you get once you get your 3D printer. You can scan. The ways you can do it, you can scan, you can print the models, and if you still do suck downs with thermoforms, you can still do a thermoform splint. You can scan it. You have an outside design surface send you an STL file, and you have a file, and then you can print it. But then you also can have your own CAD, like the computer aided design. A lot of scanners come with splint CADs. I know the Medit 700 teamed up with D3 Splint that does like an automatic splint design where it's pretty cool. It comes right from your Medit. It's teamed up, it's streamlined, it's efficient. Same with Splint Studio. With 3Shape, you do have to buy this as a separate add-on, but it's pretty cool that you can just design it. You don't have to do that, print the model, do a suck down, and then trim it. It fits in really nice. The resin profile is a flex base. You can do a flex base partial, like hard, soft night guards. So it's awesome. And also, it's much easier for patient acceptance. And what I mean by that is, you're a patient, I'm going to give you kind of two alternatives. One is pre 3D printing is, hey, I'm going to get you a $500 night guard. And then when you lose it, I'm going to have to do an impression and get you another $500 night guard. And then the dog eats that one. And then I have to get you another $500 night guard. Or what we implemented in our office is kind of like it's not night guard for life, but it's, hey, we can do this and we can get you this $500 night guard, but we'll give you two of them. And then say you're the waitress, you take it out, you wear it during the day, and the waitress puts it in your napkin and throws it in the trash, or you lose it over the board on the cruise ship. I've heard both of those stories. You pay us $50, we print you a new one, you come pick it up. We know it fits, we know it goes in. And that. And whenever you need a new one, it's $50. What is the patient going to say yes to? Again, it costs you $1 or $2 to print. So you're still making money each time. You still have an ROI. You don't have chair time. You don't have new impressions. You don't have an additional lab bill. So we just say that to the patient, like, oh, that makes sense. Yeah, but that's a no-brainer. That's easy. So we implemented that. Or you want to sell a case. Oh, sorry. You want to sell like the high-end aesthetic case, you want to sit there and put it in your lab, just put 2 free $500 night guards. There's an extra, like, oh, I got $1,000 worth of night guards for free. Again, it costs you a few dollars with a digital scanner and 3D printing. So ways that you can do it, ways to get instant ROI, ways to get patients to say yes. It's one of the easiest and direct. As soon as you open it, you can add that. Most printer kits, starter kits come with a resin, with a bite guard or splint resin. So it's something that you should definitely implement. Your assistants can do it. They can see it. They can post process it pretty easy, polish it, make it look good. Or this is something pretty cool. You can have a night guard by the end of your patient's recall visit. With the Sprint Ray, like all the speeds with the S system that they've implemented, you can scan at the beginning of the recall visit. And I think it's for $30 for a design service AI within a couple of minutes. You can get a print guard done, I think, in 45 minutes. So now you don't add, $30 for a design, but what does it cost for you to have an assistant set up a room, deliver a room, and set up a separate appointment for that patient to come back? That's, typically, I think it's $68 to $70, or probably much higher now. That was when I was in dental school, for, just to sit there and deliver something. Or it could just be done in your hygiene chair right away by the end of the appointment. So definitely, that's where it's like, okay, for $30, if I get this done, they don't have to come back. And they say yes. Hey, do you want one now? they're going to say much yes if they don't have to come back to get it delivered. So something really cool with the whole, again, straight system. Something we're starting. I don't have the S system. I have so we haven't implemented this, but it's something that interested. And I've had friends that have done it, and they just can't explain how many patients just leave with night guards by the end of their recall visit, which is amazing. So 3D printed temporaries. This is outside of hybrids. When we do our complex restorative, this is where I see the biggest value and biggest kind of patient satisfaction is with the temporaries. These are, we're talking about like complex restorative. We're talking about, changes in BDO, changes in aesthetic length. We're changing in extraction immediate implants and long-term temporaries, that a patient isn't stuck in a flipper, that we're changing the aesthetic profile. So this is, again, if I'm not doing hybrids, this is what I'm doing. You tell the patient during the consultation phases, hey, there's no guesswork. We're just going to sit there, send the impression off and kind of hope for the best. We're going to let you live in this. We're going to get your feedback a week later. We're going to communicate back to the lab tech. And a good way, you hear people starting on third, our lab techs get to start on third and hit the home run and feel like they hit the home run because we're giving them all the information. We're dialing in the, incisal edge position. We're doing into the cant. We're dialing into shape, size, contours. We're not hitting a home run, but we're taking, people, to third and let our lab techs bring us home. And we're they're covering them for once. They get to see it, they get to feel it, they get to get feedback from loved ones, because sometimes you deliver a case and then the patient comes back because someone in the family said that they're too big, they're too light, there's something, and then it deflates them. So they get all that feedback in the first week or two. I tell them to go visit every family member they can while they wear their temporaries. The tissue management is amazing versus your chairside temp. I don't care if your assistant's been doing the best temporaries for 30 years, it still will not match these as far as tissue response. You get a lot less heme. You're not sitting there worrying about delivery. Like, is there a piece of blood that's going to come up and get stuck in there? Now I'm cutting off a permanent crown that you can see the blood seeping through. And personally, I remember my first couple of big aesthetic cases. I can't remember a lab process temp that's ever gone in smoothly. They've never just sat there and the lab process temp went right in. I think I've spent more time. I think I've given up on most of them. It's just I'm just going to do chair side. So they look good when they come out of the box, but they never go in smooth. And the patient breaks a temp. I've sat there, I've tried to loot them. I've tried to sit there oh, it's veneer prep. Just don't bite on anything. I'm just cross my fingers. Hopefully it lasts me 2 more weeks. They break it. I print 2 at once, so I have a backup ready to go anyways. And then okay, cool, they break another one. Then obviously something's wrong there at the dress, but it could be the material strength. It could be super conservative preparations that this material isn't made for, and I just press a button and it's ready to go. And that gives them the patient a sense of ease that hey, I have backups ready to go. When you call, just call us and we can press a button. It's done in an hour. And like I said, I do this, the implants, they're not dealing with flippers, extractions, we can contour the tissue with ovate pontics, and there's never anything coming in, nothing coming out. So this is a patient that came in. We're going to go into a couple cases with these 3D printed temporaries. His only complaint was, hey, my tooth number 7 broke. That was it. So, my conversation, kind of looking, you see some older crowns, you see some wear. If you look at the Occlusal, these are all worn out, they're chipping, they're staining, and then just getting a conversation of, so if I'm doing this number 7, I'm going to make it look like these other teeth. Is that something you want? And that just started the conversation going. No, I hate my teeth. I hate the way they look. He didn't come in saying he wanted aesthetic rehab. He didn't come in saying that, change all my teeth, fix all this. And so just by that conversation of, I can make it look like the other teeth, but you just have to tell me that's what you want, because if you want me to change, I have to change it when I do that. I don't want to do that tooth and then have you change the rest of your teeth. And I've had patients do that before. I'm sure we all have. So basically, we sat there, talked, and we basically agreed to, changing all these old crowns on the upper right. These teeth are heavily restored, heavily worn in the upper anterior position, flared, flat, shape. So we extended for maxillary upper rehab, some contouring the lower, and then some core whitening. So usually with cases like this where I don't have to restore the lower, a lot of times when we restore the upper by itself, the bottom comes shortly thereafter because they like the top shortly afterwards. But this is what we did afterwards. These obviously we like to go a little bit wider. Again, we try to get them up because one, that's going to sit there and say, hey, the bottom is severely discolored. This is pre-whitening, so we haven't done the whitening yet. But now I want my bottoms wider as wide as my top teeth. We don't get them trying to match the lower. But you can see same day, these are right there in the middle. Those are the same day 3D printed temps that we put in that day. Then what we do is a week later, because the patient's obviously numb, the patient has no lip mobility, the patient has feedback, the patient has a smile, the patient hasn't seen himself in different light or mirror. We get them back a week later for photos, we get them back for lip mobility, we get them back for feedback, and these are just a week later. So he's still in temporaries, we're still waiting. He just finished the core whitening, and his crowns are going in, I think, next week. But this is what we can do just in one day without. This is just prepped everything. We saw where his bicuspids are going past his lip line. His incisal edge position was nice. So it's a straightforward case, and we just change the shape, contour, color, size, and then basically I copy this and then tell the lab here it is, and then again. We're not hitting this is perfect. No, these are finals. Would you be happy? No, but is this a significant upgrade? The same visit from when he leaves the office? Yes. And these are just 3D printed temps, and you can see the tissue responses. They look like permanents with a tissue response. There's no inflammation. There's no reddening. There's no bleeding. It's pretty amazing. So case number 2, this is another ongoing case. This patient who happens to be my mom's boss, which always adds a little bit more pressure. I hate my front teeth and I want to be done with Invisalign. So a couple things we can fix, a couple things we can't fix. Obviously there's deviation to the midline. It's off to the right. She has one bicuspid missing over on that side. She has 2 on the left side. So something without ortho, I can't, orthodontic surgery, I can't fix. Also, number 5 is number 12, sorry, is a vertical root fracture, broke off, post came out, non-restorable. So that's an immediate implant that we're doing. So obviously, this is an additive case. We're not going to make 8 and 9 bigger. You could say 7 to 10 can be added, but you need to take away a little bit from 8 and 9 to get some occlusal harmony or aesthetic harmony. So again, same day, there's her before, there's her smile. You may notice the little spacing. We try to print it as one unit, and we had to section it just for the pathodraw issues. But these are the temporaries going in that same day, 3D printed. These are the 3D printed temporaries. Again, that spacing, that's just us taking like a IPR burr to split the temporaries into 2 different pieces. And then that's a huge difference. Again, I'm not going to adjust the midline, but the midline looks significantly better because it's perpendicular to our interpupillary line, even though it's off, a couple millimeters to the patient's right. And then, the patient still had, like she wanted some tweaks and changes and all this thing. Number 7, number 10 looks a little bit too big, and basically, trying to calm them down and appease them that, hey, we're getting the lab tech to sit there like, hey, this is what they perfected from here. We just get them pretty close with these 3D printed temporaries. We copy that, we take photos, we take digital impressions. The patient goes home, and then the lab's like, okay, awesome. I can see the lip line. I can see where this falls on the lip line. I can see the midline. I can see here. Then they just make ideal proportions from there. But again, one visit, and we place the implant on number 12. It's integrating, but she doesn't have any dental space. We just put a temporary bridge over there, and we'll restore that individually later. And the third 3D printed temp case, again, wasn't an additive case. This isn't a case I wouldn't take shell temps and kind of layer them on, mostly because tooth number 7, tooth number 10, they're pretty large, they're protruded, they're kind of flared out. So I wouldn't want to make those bigger. Those need to be calmed down, I think, looking at the smile. And basically with this patient, we just did a quick DTS Pro or a Smile Design or something. This takes me like 2 minutes to do, or I show them before I show them afterwards. There's a bunch of different softwares. Like this is what I use usually to kind of promote cases or show patients or educate patients on what's possible before and afterwards, less so than the mock temps. But this really helped kind of show the case and telling the patient that, hey, we're going to live with temporaries, and it really helped in this case. Because when we did the temporaries, they were too big, they're too bulky. And the canines were kind of just what I call kind of duckbill. They weren't dominant. They were kind of coming in. You can see the bicuspid. The patient wasn't happy. They felt too big. They didn't fit her face. I have photos of her face, and I put this note in here to kind of talk about a procedure protocol that we just added to my office. Because what would happen is we have these light box where with your cell phone you can take all these high quality, great photographs. It's not with the DSLR, it's not with the big camera setup. It's with my assistant's iPhone. So when they take patient photos with iPhones, they just send it to the lab and delete it because they want to leave work and not care about teeth and leave dentistry alone. So for me, we started implementing this protocol. So this is what this note is. This is something that I would, strongly recommend implementing, right away. We got Google Pixels because we all run on G Suite. All our emails are, Google emails through the practice workspace. So, with the Pixel 7 and with this Lightbox, I can create just a whole separate email of just photos@yourworkdomain.com. And that way they know whenever they need photos, they're going to take these photos with basically this little setup that's magnetic that takes all the photos that you've seen through this procedure or process. And you can access this anywhere on you have an internet connection that you're logged into your photos, and then you can have it to communicate to any lab to add it to any slides of any presentation you're doing. Because I was texting my assistant, where's that photo? And she goes, oh, it's gone. She's linked to the lab. So something little like Pearl to add is, I would say, you can buy a Google phone for like $500. It has all the photos. Just you don't need to buy. You just add it to your Wi-Fi at your office. Again, this light box is like $400, $800. You're all in for some of the best quality camera systems you can get that they'll use, and then you can have access anywhere. So pretty cool little setup that we've just used, both offices. The team really likes it that they're not using their own cell phone. So when the kids go through their phone, they're not seeing all the teeth as well. So here's that patient again. Afterwards, these are just the temporaries. Again, I think we got it pretty close. It's a couple little minor tweaks. Maybe have the right side come down, follow the lip line a little bit more. But the patient to live in this, smile, say, I love these make me happy, and they're not. You're not delivering the permanence without the guesswork. You're getting all the information. And again, these are just the temps. I mean, that's a huge improvement. Like I would be pretty happy for those if those were just my, permanent ones. But the permanent ones will be even more aesthetic, a little bit more nicer. But the patient was happy, like the whole process. And it's a huge selling point to patients where they're, spending this type of money, spending this type of time, they're, fully committed. It's like, hey, I'm going to make sure that you're happy, or you're happy enough that we can make just minor tweaks, aesthetics for our lab tech or ceramists to bring home the aesthetics. And here again, some of the prep, some of the cases. Here are the tissue responses. Some of these patients have been in temps for 3 to 4 months while implants healed and integrated. I don't see any bleeding. I don't see any inflammation. Like I take off before it needs to do chairside temps. I would see just blood gushing everywhere, tissue inflamed. Like you'd have to do hemostasis, packed cord. Like I think all 3 of these, they've had the cases in for 3 to 4 months, and the tissue still looks like that afterwards. So going ready to cement, makes life easy. You cement it right away. You don't have to worry about contamination or blood getting underneath your permanent crowns as you cement. So small lockups, I'm getting a little bit more into these. Again, the cases we featured, I'm still working on, but haven't been added the features. And where I think the value is if you have those really demanding patients, or if you have those patients that have an additive case, that's where this is going to be kind of your wheelhouse. So yeah, I mean, the biggest thing is getting all the photographs that you do need. You get your digital scan. And here with these two applications, we have SmileFi, but one of my associates is going down to Miami for DSD for residency. So I think both of these with an iPad, you can sit there and design and be able to manufacture some of these temporaries where you're basically hitting a home run right from the temporary phase. And then basically you design it here. You can send directly from these two applications directly to your 3D printer, and then you can sit there and deliver a shell mock-up. So we did this on this patient today. The biggest thing is kind of narrow buccal corridor, a little bit gummy. We sat there, but by the time we went to go print, the print was the model, and then we didn't have photos of the suck down, but you can sit there and see this is all an application on an iPad where we're designing, we're doing this. And then once we can print the shells and then deliver that to the patient. Or what we could do is you could print a model and then you could do a suck down putty, and then you could do like a bisacryl and then just really lay that to the patient's mouth. So both of the times the patients get to actually wear the teeth and see what their teeth look like in the smiles or in the different lighting, wear it for a week. It's like a snap-on smile. But I think this is where these applications come really handy, especially if you don't have the full dedicated built-up laptop. Is going to be like I'm relying more on ExoCAD and ExoPlanner and Smile Designer versus just getting into this. I would look heavily into the DSD or the SmileFi, which are both seamless applications with an iPad. So it's pretty cool that you can just bring in the STL folders. They have their own apps. This is the digital scans, and then you're designing based on 3D mockups. And then some other cool cases that we're using with our 3D printed temps. This is the patient. We placed these two implants. We knew that 8 and 9 were going to go, so we just did 2 distal cantilevers. We took out 7, we took out 10. They had roots that were just falling out. We did distal cantilevers. So after the integration phase, the next phase is taking out 8 and 9. So my biggest thing is I want my implants to dictate tissue. I don't want tissue to dictate my prosthetic restoration. So we took out 8 and 9. We placed 7 and 10 have been integrated for about 4 or 5 months. And then we delivered the same day 3D printed temporary under PRF. So laid a full thickness flap, opened it up, did scans, placed this temporary, laid PRF. Now this is going to dictate. So now these will look like natural emergent teeth underneath from the gums and contour the gums and shape the gums and heal and widen the keratinized band around these implants so that when he smiles, they'll look like teeth, like he's had these teeth his entire life. So this is all same day of surgery, which is, an awesome thing to do with implant dentistry or aesthetic implant dentistry, especially with aesthetic high lip lines or highly aesthetic demanding patients. You can contour, control, and contour the tissue of the implants the way that you want to. And here's that case I kind of mentioned earlier. So this patient, 3D printing saved me, or saved this case, or landed this case. The patient had all the sinus and ridge augmentation by this periodontist, and after that, her partial didn't fit. She had a cast metal partial, and then the other dentist she was going to is like, okay, it's another $5,000 to get this partial made, and it's going to take 8 weeks. But then she's like, I'm getting a hybrid, and so she got our advertisement, and she her biggest thing is she's going back to Brazil in 10 days. And she has no teeth. Like that's it. This is what she came in with. So we took these scans. We had no video, we had no records. We just took photos and just kind of manipulated where the jaw would be digitally. And then we used the 3D printed flexible based resin. And basically this is what she left with today. This was like, okay, we're going to try to get pretty close. I think we got pretty close. And then, this is what she's going to leave with temporarily. And then we're going to print another one that we're going to deliver on Thursday. So 2 days from now, we can tweak it, add a little more palatal strength. So she's going to Brazil with not one, but also a backup. When she had no teeth, it was going to take, 10 or, 8 weeks and, $6,000 versus we just included in the cost of our hybrid. And, she signed up for a $30,000 surgery because we're able to adapt, understood her need, understood she didn't want to go to a third world country without, big trip without teeth. And it's just like, well, and then we didn't charge for it because it cost us a couple dollars to print. So, I mean, this is, some of the things like this happened today. This patient I saw this morning. So these are photos from today that we took. So this is what it does for our practice. These are the procedures it does for us. And I kind of mentioned, some of the adaptations and some of the companies that what they're doing. Oh, there's that photodontist. Sorry. So in last month, if you didn't know, the ADA changed definition. It doesn't need the manufacturing method. So anything that can be a dominant definitive crown goes under the 2740. So I know Sprint Ray is launching this at Lab Chicago or Chicago next week or two. So it's going to be a pretty big announcement. I'm sure most other companies are going to follow suit. So you're going to be able to print 3D printed crowns and call it permanent. They're going to show up radio opaque on your restorations. Aesthetics, I don't know. I haven't had my hands on it yet. But again, these are the type of adaptations, innovations you want to kind of look for. And, hey, you can print 3D crowns versus, drop in $140 to get a reductive process to, mill, in-house crowns. So even as long-term temporaries, even as something that you can sit there and like, hey, the patient can't afford this, but we can have this in-house option. There's going to be so many different ways that you can deliver the dentistry, do the dentistry you want to do for, pennies on the dollar. And this is my son. We can print Pokemon too. So he comes to the office, and the first thing he wants to do is, what can we print? So I think we're printing a Bulbasaur that day. So he paints him afterwards. That's his little arts and crafts. So it's awesome for your family. It's awesome for your patients. It's awesome for your assistants. Like I said, lab techs, maybe not so much, but it's awesome for us and what we can do for our patients too. So I think that's the end of the presentation today. I appreciate your time. Again, so my Instagram's there. Any questions, like I said, here's my personal email address. This is my cell phone. Again, don't hesitate. Most people get back to you pretty quickly. I appreciate the time. I appreciate the effort of staying up and getting through this. So we'll open up to some questions. Stephen, I think you can take it from here.
Yeah, thank you so much, Matthew. Appreciate it. So right now we can go into Q&A. If you guys have any questions at all, you can submit it through the Q&A function right here in Zoom. And so in fact, we do have one question already. And the first question comes from Nicole. Question is, what program are you using to design your temporaries?
Right now we're using Exocad personally because we have a dedicated lab tech that does that. Like, he's pretty proficient in Exocad. But there's a whole different bunch of libraries. There's a bunch of different ways. I remember used to doing it in Mesh Mixer, downloading a library, doing it that way myself too.
Perfect, thank you. All right, we'll just give these guys a minute, see if any more questions come in. So again, you should see the Q&A function right at the bottom of your screen, and you can go ahead and just type your question in there. Okay, we've got another question here from Alex. Where can we get more education on 3D printing?
Great question, Alex. I know there's a few more deeper dives. One company that I know that does a great job with Tim Anderson is going to be a 3D dentist. It's at 3ddentist.com. They do a bunch of webinars. I know that Implant Pathway has 3D printing classes and lectures as well. The Mod Institute, Sarah Charleston, I know they do a whole bunch of 3D printing. Those are some that come right off the top of my head. But I think, you starting there, looking through their 3D dentists, Implant Pathways, and Mod Institute kind of come to mind first for me.
Okay, fantastic. All right, now we're getting starting to get a few questions in. Okay, so we have a question here from Daniel. How does the strength and longevity of an acrylic bite splint compared to a 3D printed one?
I haven't seen too many fractures. I mean, I haven't gone too far into the mechanical science of splints, it's not really my area of focus. I just know that if something breaks or if it fractures, again, what is the cost of replacement? A dollar or two. So like I'm looking at a practical sense of, is it discluding the teeth? Am I having, is the patient, not parafunctioning? And then if it fractures, what does it cost me for replacement and for the patient? It's, I don't have to get a separate impression. I don't have to get that sent to a lab. I have the STL file that I can just re-download, reprint, and process.
Okay, fantastic. Thank you. Next question comes from Adrian. Do you print the flipper as one piece and stain the gingiva, or two pieces with different color resin?
We do two pieces. So the flexible base partial, or the flex one, that material is only coming gingival colored. So typically then we print it with like an Onyx software Flexera, and then you basically just loot them like with a resin right after the post processing. So.
Okay, fantastic. Okay, next one comes from Autumn. You mentioned printing metal. Can you tell us a little bit more about that?
I don't know much about that.
No.
I know where I am located outside of Boston. There's a company in Burlington, Massachusetts, that is printing. I mean, they're doing bigger applications for it, but they are 3D printing metal. And I'm assuming just with any sort of workflow, there's innovation. Then as it comes down and as it gets more streamlined, then it gets adaptive. But I know there are companies that are 3D printing metal. They're not for dentistry at the moment that I've heard of. But yeah, I know there's a company, a couple towns away that is 3D printing metal for other applications. They're doing metal additive processes.
Okay, all right. So next question is from Safrez. So it looks like using the sprint tray for temporaries. How long to print, wash, cure, and finish?
So the biggest thing is going to be, so it depends on what temporaries or how many temporaries. So is it a full arch? Because it's design aspects. So the biggest thing there is going to be your CAD. You need to have a chairside design, but say I'm printing, if you have the Pro 55S Lightspeed, you can print it in 12 minutes. You could, hybrid's like 20 minutes, post and process in 8, and like 30 is finished in 45 minutes, start to finish after they end to finish the temporary.
Okay, fantastic.
And they're just hanging out in the chair. They're just like watching Netflix. I'm like, it's gonna be better for all of us if you just hang out here. So.
Okay, great. Thank you, Matthew. All right, next one comes from Jeremy. Do your associates enjoy using the 3D printing workflows?
No, they hate it. I think it's good for my associates.
Okay, all right, let's see. Next one here. Okay, from Alex, do you feel that 4K and 8K type printers are sufficient for these types of restoration, or are sprint tray and form labs really the standard?
I think it's the resin profile and what they had and can they adapt to it. I think so there's different levels if you're proficient with it. And then if you are, hey, I just want a seamless, kind of start to finish integrated system. There's printers that I use that basically are just kind of printing machines that just print at speed, but they have the resin profiles of like Flexera, or they have the Onyx stuff where I can use those resins ubiquitously in a single place and then get it done super fast when I need to. But I think, again, friends that are just getting into it, I've 20 friends I've convinced into printing, and I think almost all of them, I've told them, jump into Sprint Ray. Like, I'm a proponent of that. They've all gotten the same message from me. Like, even though it's probably the printer I personally use myself the least, but the office uses it a bunch.
Okay, and Alex also adds Porsche and Bugatti are printing their brakes, FYI.
What's that?
He says Porsche and Bugatti are printing their brakes.
Yeah, that's news to me. So I learned something new today too.
All right, great. So we have a couple of questions about resin. What resin are you using for flexible-based removables?
That was the Graphy. I think going back, I can kind of, it's Grafy. There it is. The Terahar. Oh, there it is. If you just look at that side, it's it's pretty, I think you can use it on, you can use it on a sprint ray, and you can use it with the resin profile. We use it on a couple of different other printers. I think the Sega we use it on as well. So, but that's that resin. Yeah. Yeah. Got it from a friend, Sally, who teaches, 3D printing at, 3D dentist. So it's been awesome to, be able to print this, same day flippers, or, someone that has a tooth extracted, I can take out the tooth, scan the healing, not guess where the healing is, put it in. So.
Okay, thank you, Matthew. And next question, maybe by the same attendee, is the resin profile in the sprint ray systems?
That one is, yeah.
Yeah,
I know that
okay.
one is.
Okay, perfect. Another resin question. How do you deal with resin waste? Just down the sink?
I mean, typically you're always adding. So you don't have much, as long as you kind of maintain, agitate, and kind of rebottle. There's not much waste per se. And again, I have a dedicated lab tech where I haven't changed resin tanks and resins, I don't know, in like 3 years. So but it's usually you take like a strainer, and then you put it back into the bottle if you're not using it. But like I said, with what we're doing, we're just constantly adding, agitating. There's not a ton of waste that we're throwing away. So it doesn't seem like something that we're dealing with frequently, or something that's ever been brought up or concerned.
Okay. Next question is again from Alex. Do you find that multiple printers are needed based on resin type? For example, one printer for removable, one for temps, one for night guards, one for
That's
surgical
more of a volume
guides?
question. That's kind of, I don't know your practice. I don't know. For us, the way we do, I have 4 going because we have 4 different resins going at a different time at different speeds. Some are for same day hybrids, some are for same day temporaries, some that we can sit there that take the same resins. Like, I like an open source resin profile. I have a couple of printers that you sit there and just give them the resin profile, they'll add it to their system and test it. And like, those are the adaptations that I like in companies, versus some of the ones, no, you need our specific resin that we've FDA that we've tested and gone through our own protocol. So there's a couple of companies that are willing to learn with you, through the trials and tribulations. But I think I think having open source profiles are paramount. I just don't know. Like, we need the printers in one of the offices. The other one we're fine with one and changing out the resin trays.
Okay, fantastic. All right, we've got another question here from Daniel. How do you manage the fumes in getting proper ventilation when you're printing?
There's not much fumes, honestly. It's in all the 4 of those printers are in our staff break room. You're not seeing, there's no, I haven't noticed any fumes. No one's ever noticed any fumes during printing process. Yeah, it's not like I took my kids to Funtown Plaster Time where they had an air spray, plaster afterwards, and I couldn't breathe in there. So I'm pretty sensitive to that stuff, and no one's ever noticed, complained, or said anything about the fumes during 3D printing.
Okay, all right, we're going to take one last question here. This is from Autumn. What resin do you use to print flex-based partials? Is it the same as dentures? And where would you suggest to go to have someone design one?
Design services, there's going to be labs that are going to be able to use it. So you can search for designers. I'm not too sure. I think Sprint Ray is going to have their own too. It's the same FlexBase too. You can ask your lab, if they're a digital lab, if they can just design it for you and send you the STL if you get the resin. We design it ourselves because we have the ExoCAD suite and we have someone that can design it for us. But I don't know of a lab that's going to specialize in removable flex space, but I'm sure they're designing it digitally as well and printing them as well, and they can just send you the STL file, then you can have it. And that way you can print it as soon as possible. But it's the same flex space. It's the Terra Hars from Graphy.
Okay, fantastic. Thank you. All right, so I think we'll finish up there. Do you have anything, Matthew, you'd like to
No, I just
end before
appreciate everyone's time and appreciate it. Thanks for helping out, Stephen.
Yeah, thank you. Well, thank you, Dr. Annese, for a wonderful presentation this evening. And thank you to all of you for joining us. We did record tonight's webinar and we'll be sending out that recording sometime during the next week. We'd appreciate it if just in 1 second when the survey pops up on your screen, if you wouldn't mind just filling that out and giving us some feedback on this evening's webinar. It helps us for future events. So thank you to all of you for joining us, and we look forward to seeing you on future webinars.